Hey, Dr. Bricker, good morning.
Hey, good morning, Spencer.
Who'd have known that insurance can be a little rock and roll, right? Like trying to add a little coolness to an industry that doesn't have a whole lot of cool, as you know.
Very good. Well, that music is from our generation.
So if you, I was joking with a previous guest that I paid like $9 to get that because I didn't realize early on, I made the mistake early on, if you use actual music, even if it's 5 or 10 seconds of a clip, you'll get a copyright flag immediately.
Sure.
Yeah, YouTube has their algorithm. They can find essentially anything.
Yeah.
So I bought one that is free and clear, and I can play that music every time. But anyways, appreciate you joining me this morning, and thank you for being flexible with scheduling and all that.
Hey, thanks so much for having me, Spencer. I think your podcasts and your videos on YouTube are fantastic. They are so good. You have to watch Stop Loss with Spencer. If you've not watched this on YouTube, you have to. It is really good.
Well, thank you, sir. And I appreciate you buttering me up a little bit. It's always welcomed. I think if I can do the inverse as well, I learned by watching you a little bit with your whiteboard series. And you certainly, I believe, are the professor when it comes to whiteboarding. For the folks that don't know Dr. Bricker, we'll get into your background. We'll get into all your content creation as well. But you are a machine. Almost every morning I see something out there, and the level of engagement is great. So keep doing what you're doing, sir. So asking how you're doing, of course. And I also, if you don't mind, want to ask, how are the alpacas doing?
So I live on a small alpaca farm, and we have just 3 alpacas, but we also have some chickens and some longhorns that graze in our pasture. But the alpacas are doing great.
Did they survive the winter storm we had?
Yeah, so alpacas, they're from South America up in the Andes, so they're used to really cold weather. And frankly, they've got a ton of fleece. They need to get sheared every spring. So actually right now they're getting kind of hot.
Okay.
So they're going to get sheared next week, and I'm sure they will feel much more comfortable.
Well, so that's funny. We had a conversation, I don't know if it was 8 months ago, 8 months ago, where we were just talking about your advice for me on some content creation and how to set it up. But in that conversation, we got on the subject of alpacas, and you shared with me that there's a family or a company that travels the country, and you have to schedule to get them sheared, right?
It's like being in a rock band. They go on the road in a van, and they come down from Ohio. There's other folks like in Montana that hit the West Coast, and it's like this whole like subculture of itinerant alpaca shearers. So who would have thought? That's
funny. And may I ask you, was there always an interest in owning alpacas, or what was the draw there?
Yeah, so you've got to have animals in order or hay to keep your agricultural exemption here in Texas. And so alpacas actually count as livestock. They're not considered exotic. So you can't use exotic animals. So you can't use like zebras for your exemption. It has to be livestock. So alpacas actually do count as livestock, and they're incredibly docile. So they're very shy. I've got 3 children who are fairly small, so I can be very, sort of comfortable that the alpacas are not going to get aggressive around them. And they're very easy to maintain. I mean, my wife and I are both city slickers. We don't know anything about farming. And so we needed something that we were capable of doing. And alpacas are just incredibly easy.
That's cool. And not to digress too much, I did grow up with a friend of mine. His mother raised llamas, which I know is similar in the family. And I remember they were fairly easy to take care of, although the punishment for him, or the chore that he had to do always, was the poop scooping, which
farms involve poop. That's just the way it is.
I got sucked into it a couple times. Yeah. I was like, this isn't that fun. But anyway, so let's, of course, get into it. Although I could do alpacas with Dr. Bricker as a future podcast.
That'll be another podcast.
That'll be a different podcast. Right. But so I think I obviously know you well and know your work very well. I think anybody that follows you or connected with you on LinkedIn likewise does the same. But anybody that doesn't know Dr. Bricker, if you don't mind, can you give us a little of your personal and work backstory that has led you to today?
Sure. So I am an internist. I graduated from undergrad in 1998. I was pre-med. Every single doctor I talked to said, whatever you do, don't go into medicine, because at that time, HMOs and managed care were, ruining the practice of medicine with all the bureaucracy. And so instead of going straight to medical school in the late 90s, they were just giving away jobs. You couldn't not get a job when you were graduating from college in the late 90s. And so I went and I worked for a hospital finance consulting firm that helped doctors and hospitals get paid from insurance carriers, Medicare, Medicaid. So I learned a ton about the claims, a ton about the bureaucracy in healthcare, all that paperwork side of the business. And I decided I still wanted to be a physician. So went on to medical school at the University of Illinois and then residency at Johns Hopkins in Baltimore in internal medicine. And I chose Johns Hopkins because it's in the same town. So CMS is headquartered in Baltimore as well. And I thought I wanted to be a policy wonk. All right. I saw so many challenges and frustrations and problems within healthcare, and I wanted to go the policy route. And then after being in residency only for a short amount of time, I realized that I was just too impatient to go the policy route, because publishing papers and then not necessarily seeing any sort of change come out of that was just going to be too frustrating for me. So I just wanted to get my hands in it, and really just for reasons of temperament, became an entrepreneur and started Compass Professional Health Services with a colleague of mine from back when I was a hospital finance consultant. And we bootstrapped the business starting in 2007 with a third partner. And we grew it to over 2,000 employer clients. And Compass provided healthcare navigation services for employers and their employees and their family members on their health plan. And this was when the consumer-directed health plan just started coming about. And so people's copays were going away, and they were getting this HSA or HRA debit card. And people were like, okay, now what do I pay? And at Compass, we actually provided the in-network price transparency along with concierge services like problem bill resolution. We would help you find lower cost prescriptions. We would find doctors that met the specific specialty need that you needed. And it was put in conjunction as the tool for the employees along with those CDHPs. And so we then sold the business in 2018 to Alight Solutions, which is essentially the HR outsourcing spinoff of Aon. So Aon bought Hewitt, and Hewitt did a ton of HR outsourcing. And so the Alight offices are still in the Hewitt headquarters in suburban Chicago. And it's a 10,000 employee company, billions in revenue. And they were able to use Compass to sort of augment their existing navigation services. And it's been great for the employees. Compass itself has grown underneath Alight. It's not even called Compass anymore. It's Alight's Health Navigation Solutions, which is fine. I'm not particularly tied to the name. What I want is the assistance to be able to grow for people. And that's really why we wanted Alight to buy us, because they worked with very large corporations. And we had about 2,000 employer clients, mostly mid-market. And so to be able to then take Alight's benefits administration platform and then bring Compass to so many more people, it's just awesome. I'm just so thankful for all of our employees that are still there, and thankful for Alight for that. And so I'm in my mid-40s, and I just knew that there was still a lot of misunderstanding in terms of how employers and employees were, to a certain extent, just being taken advantage of by the healthcare system. Okay. And that there are many solutions out there that are trying to help them, whether it be through a transparent PBM or a variety of other services. But it's really hard to sell a solution if your customer doesn't even understand the problem that they're having. Yes. And so you got to sell the problem before you sell the solution. And so I'm like, okay, well, let me help educate people on really, at the end of the day, for better or for worse, healthcare has a lot of deceptive practices. And so let me, because I can kind of shoot people straight, I'm independent, I can say, hey, this is kind of how things really work. So that when you do have somebody coming in, whether it be a broker, a benefit consultant, or a vendor coming into HR benefits saying, here's a solution, then you can put that solution in some sort of context, because you're like, oh yeah, I heard, Dr. Bricker and his AHealthcareZ videos about that. So AHealthcareZ is healthcare finance educational videos. It's on YouTube, and I post them on LinkedIn as well. And you and I actually live near each other. Yes. And you're on LinkedIn all over the place, and you do videos. Yeah. So apparently North Texas and the Dallas-Fort Worth area is the epicenter of insurance and healthcare modern media communication.
Wait,
so
who'd have thunk it,
it's
right?
the Hollywood, basically. So if you live somewhere else in America, come to Dallas, because this is where it's happening.
This is where it's at, man. It's funny you say that, because I think the towns that we live in have a combined maybe 50,000 people or so. But I think you're right. And I mentioned potentially that, I'm somewhat of an apprentice to the methodology that you use. I have a great deal of respect for what you do there. And I think I'm even going to schedule some time with this discussion to go in depth to content creation and your MO and your perspective. Could we take a step back, though? Because obviously the general summation of what I want to talk about is the self-funded industry. I'm motivated by what self-funding can do for and to employers' bottom line, as well as the population themselves, how they can benefit from it, the members themselves. So you mentioned healthcare navigation. Can we unpack that a little bit more? What is healthcare navigation? How would you define that?
Yeah, so it is now actually a space, which at the end of the day, when Compass started, like it wasn't even a thing. So to a certain extent, I want to be humble when I say this, but we kind of helped put it on the map.
Created a category, right?
And there was other companies too. So there was Health Advocate out of Philadelphia, and there was Accolade out of the Philadelphia area, and then also Seattle now as well. There was the company called Castlight that tried to do it through a SaaS platform. So essentially, people realized that the healthcare system is so complicated itself that just being able to navigate the healthcare system completely in a non-clinical perspective, in other words, not the decision between the doctor and the patient over what test or procedure should be ordered or what the clinical plan should be, but just actually navigating all of the bureaucratic hoops and the disjointedness and the disconnectedness within healthcare itself actually causes a lot of financial waste for employees in terms of their out-of-pocket cost and employers as well. What does that mean? Specifically, moving to a consumer-directed health plan, when we started Compass, was only about 2% of employees. It is then, if you go through the Kaiser Family Foundation numbers, it's upwards of about 33% of employees now. So it's number 2 after PPOs. And if you look at a consumer-directed health plan, it's actually actuarially superior to a PPO plan, right? Because you're just basically throwing a whole bunch of money away in the low deductible PPO plan design, where if you raise the deductible but then give people the money back, you could even give them all their money back. You could raise the deductible to $2,000 for an individual, and you could give them $2,000 on an HSA card or an HRA account that rolls over year to year. And they, instead of acting in sort of a blank check perspective, I call PPO sort of the passive provider organization, sort of jokingly. Here's my $25 copay, doc, do whatever you want.
Right.
Instead, the consumer-directed health plan design encourages people to be active participants in their care. And there's actually a quote-unquote official term for this. It's called shared decision-making, which, believe it or not, only in healthcare would this be a novel concept where there's a shared decision between the doctor and the patient, right? Yeah. Right? Typically, we have this paternalistic relationship where the doctor just tells the patient what to do, but that's actually not good for people's health. They've actually done studies to say that when the patient and the doctor come to a decision together, that actually the person's health and their decisions are much better than when it's just totally run by the doctor. And so that's part of the reason why that consumer-directed health plan is actuarially superior to a traditional PPO plan. But then there's a problem. Okay, the employees then have to be quote-unquote healthcare consumers, which is impossible.
Sure.
People within the health insurance industry, what was one of the major customers of Compass? Health insurance brokerages themselves.
You're telling me that a lot of them don't know how to navigate the healthcare system?
No, and they would joke and say, no, it's for the P&C guys. It's not for the benefits people. Yeah. But it's like, no, it's so bad.
Well, I think that I think obviously that speaks to why your company was able to, create a new space or a new category for that. But also I think it speaks to the complexity of the healthcare system in general. One, just understanding your benefit plan design itself. And the second layer and third layer is, okay, where do I go? What do I need? How do I even find out what I'm supposed to get or who to go to? As well as nobody has any idea what it is going to cost until you receive a bill in the mail 6 weeks later, 9 weeks later, whatever it may be.
And being able to better navigate the healthcare system, in other words, to get the right care with the right type of doctor at the right time for the right price is like totally doable. Right? That is a solvable problem, and it's solvable one person at a time and one company at a time. We didn't want to boil the quote unquote healthcare ocean. We said, hey, for you, John and Mary, or for you, XYZ employer, let's solve your healthcare problem that you're having like right now.
Yes.
And that might be, hey, my insurance is denying a laser treatment in my ophthalmologist's office for my retina because it's against their medical policy. And they said for this particular diagnosis that they're not going to cover the quote-unquote use of the laser. Who would know that? No one would know that. And that's a real example of something that really happened. And it could happen after the fact when the person's getting billed for it, or it could happen beforehand when they're trying to go through the prior authorization for it. It could be, okay, how, of course, with the opioid pandemic, I would have never realized this. We would get a call a week from a frantic parent with a child, and they were trying to find an addiction treatment center for them. And the coverage for inpatient psychiatric care and for addiction treatment is incredibly complicated. I'm not laughing because it's funny. I'm laughing because it's like impossible. And this is a fairly urgent situation where they're like, listen, we got to get them in, this weekend, before they run away again. I mean, that literally happened. And like, we were able to like get them into a place that would actually accept their insurance and go through the prior authorization. And you have to get authorization for a certain number of bed days for having inpatient, psychiatric, abuse, and very practical stuff. And you without having to quote unquote boil the ocean with policy changes, you just need to solve that specific problem for that specific person at that specific time. And it's totally doable. And like the people at Compass of Light or any navigation service that do this, I mean, they are heroes. And we would have these people who were really at wit's end because there's no one that sits in the middle as the ombudsman or the advocate on behalf of the patient. Mm-hmm. You complain to the doctor says, it's not my fault, it's the insurance company's fault. You talk to the insurance company and says, it's not our fault, it's the provider's fault. And so you're like, okay, then who's gonna help me? Mm-hmm. And the answer is no one. No one is going to help you. So you go to HR, and HR is like, "This isn't what I do," right? so that was the need that navigation fulfilled. I apologize. That was super long.
No, I love it. You know what? I love it. I was so excited to have you on because I love the level of passion. I do watch your videos in the morning. I'm generally a fan, and the level of passion you can bring to a subject like surprise billing. It's four types of surprise bills that a member receives, and I knew coming on that we were going to get excited a little bit talking. Was there a pivotal moment, though? I mean, you seem like a very, obviously very passionate person. Was there an epiphany when you were an internist working in the medical profession that said, this is the problem I need to solve? Was there a specific instance?
Yeah, I mean, and it's what every single general practitioner and many other specialty too, is they see that every day. And so I really started seeing a lot of it in medical school, where the test or procedures or what have you that needed to be navigated by the patient, the doctor was spending a ton of time having to deal with that and make that happen. And they were not equipped with the knowledge or the support staff or what have you. And so as a result, it really kind of fell through the cracks and it didn't get done. And ultimately, it was the patient that suffered as a result of that. So it was a ton. It wasn't one particular experience, but it was seeing, you do your clinical rotations in your third and your fourth year of medical school. But it was 2 years of kind of seeing that like almost every day. Mm-hmm. And it's like, yep, no one's going to fix that. Yep, no one's going to fix that. Yep, no one's going to fix that. And so then when I went and I talked to my partner, Scott, who I started Compass with, he was seeing the same thing he stayed on the billing and the administrative side in healthcare, and he was seeing the same thing. And so we knew with our I couldn't do it alone, and he couldn't do it alone, and we couldn't do it without our third partner who had all the technological and software expertise. So we know that each of the three of us couldn't do it alone, but we knew that if we put what we knew together, that we actually could solve the quote-unquote healthcare problem in America one person at a time. If we combined what we knew for one person, we could actually make it work. And so we just worked on, having these health pros that would then, take what we knew. We had a curriculum, we had software to support them that could take that and just do that one person at a time incrementally.
Well, it's interesting that there's a fable, I think I remember growing up, about there's a girl standing on the shore and throwing starfish back into the ocean, and somebody walks up to her and is like, hey, well, do you really think you're going to make a difference? Because there was thousands of them strewn across the shore. And she said, well, after she threw one, well, I made a difference for that one, right? So I appreciate the approach that you're taking, that is, I'm going to directly solve an individual's problem. And if we do that often enough to solve that person's particular problem, there could be a snowball's effect. So walk me through the building of this? Because I'm fascinated as somebody that's in a company that's in the earlier stages as well, and we're trying to solve a very big problem and think we're going to be part of that solution. Walk me through, okay, we've got this idea, we've put it in motion, but of course you talked about what, a 10, 12-year life cycle to build, to sell. So yeah, I'm sure there's some ups and downs through that. So kind of walk me through the earlier stages and then when everything perhaps clicked and you realized you were onto something significant.
Yeah, so we started, like I said, we started the business in 2007. And so the Great Recession almost immediately hit. And so we didn't bootstrap the company because we wanted to. We bootstrapped the company because we had to. We actually tried to go out and raise money and were unsuccessful. So we were very, people like to use all sorts of like nice sounding euphemisms. We were just cheap. We had office space in a very, like, I shouldn't say very, in a fairly dangerous part of Dallas. And like our office building got broken into, and our office mates next door to us, they got all their computers stolen. We just lucked out that our computers didn't get stolen, or printer or whatever. And we just didn't spend any money. We didn't pay ourselves any money. I still moonlighted as a doctor on the nights and the weekends to pay the mortgage, etc. So one, we were cheap. Two is we had to solve a lot of problems. So when you don't have any money, you have to solve a lot of problems really fast because you need revenue. You need to bring money in. Okay, so in order to bring money in, it really forces you to be open-minded to iterating, right? Because what everybody does, is everybody has like a plan. And it's like the famous, von Moltke quote is that, no war plan survives the first shot of the battle, right? And so immediately everything changes, right? Let me tell you the first thing that changed. Our company started out as a personal health records business. We were going to collect all your medical records and put it on a USB drive, and you were going to take it from doctor's office to doctor's office so that you would have this unified medical record. Guess what? No, but that might be a good idea. It might not be a good idea. No one's willing to pay money for that idea. And so we quickly learned that we needed to iterate a ton. And so we just tried a whole bunch of stuff. And my capacity was really I was the sales guy. So it was in sales and marketing. And this is really in my opinion, why startups succeed. It's because at the end of the day, an entrepreneur or just starting a business, you have to sell, right? Especially in healthcare, because the vast majority of the solutions are business to business. They're not business to consumer. And so business to business really requires sales. Business to consumer, it's a lot more marketing, right? Like if you're doing like toys, right? You really got to market the toy, but you don't really have to have like a salesperson sell the toy, right? Whereas in business to business, there is a role for marketing, but you really have to sell it, right? Going into, if you ever go into DFW or Love Field, right? What is that airport filled with? It's filled with business to business salespeople getting on planes. They all live in Southlake. So the key is, and this is where I didn't even know this framework until later on in the business, but we sort of intuitively stumbled into it because we had to. And that's the 4 Ps of sales and marketing: the product, the price, the placement, and the promotion. And typically, sales just does the placement and the promotion. And the placement is basically the channel. Like how do you bring it to market, right? Mm-hmm. Are you selling tomatoes by the side of the road, or are you selling them in the grocery store, right? Well, if you sell tomatoes in the grocery store, it's much more effective than selling them on the side of the road, right? So what is the channel? And that's where the channel was through the broker consultant was the channel. So that placement was super important. We had to learn that through trial and error. The next was the promotion. Okay, well, that's the salesperson and the marketing, right? That's going out and getting leads and walking them through the sales funnel and closing and contracting and all that wonderful stuff. Okay, that's great. Okay, but there's 2 other Ps that are equally as important, and that is the price and the product. And so there were no walls. There was no bureaucracy between me, the salesperson, and my 2 other partners around the price and the product. And so, and this is the 2 people that you need to read coming out of this podcast are Steve Blank and Aaron Ross in his book Predictable Revenue. And Steve Blank's book is The 4 Steps to the Epiphany. And literally what happened at Compass is exactly what they described in their books. It is word for word, page for page, exactly what happened. And everybody in Silicon Valley knows who these 2 guys are. And I was just like, okay, this is great. I'm just going to do what they do. And so Steve's blank big thing is that, look, as soon as you have any idea, your very first thing to do is you're going to go out and you're going to talk to 50 people about it. And because your idea doesn't mean squat. It's what other people's thoughts about your idea is what matters. So I was constantly talking to people about the product, and I was bringing that feedback of the product back to Cliff and Scott, and we had the relationship such that everybody was open-minded and very desperate to bring in revenue. And so therefore, we really adapted to things. So this is where we had no interest in doing any sort of assistance on the prescription side in the beginning at all. And it turns out that was a huge problem that people were having because their drugs were so expensive. And so we had to really sort of pivot in terms of adding that type of service. And then the personal health record thing, like we almost never did that. So it's not only adding certain features, but it's also just getting rid of stuff. Mm-hmm. And that's the key that so many startups have is they just want to add. And then it turns into this, giant, Taj Mahal. And you need to be able to cut a whole bunch of stuff away.
Yeah.
Okay. And then also too, the price is super important, right? Because product people and finance people, product people love building Taj Mahals, okay? Product people will never want to build. And again, this is a Steve Blank thing. You gotta get to the market early with your minimum viable product. Now, keep in mind, the product person's definition of minimum viable product is the Taj Mahal. So just know that that's how it is with everybody, because they want the product to be perfect because they're product people. Yep. But if you're a salesperson, I'm just like, just get it out. Like, I don't care if it's ugly, just give me something, okay? Mm-hmm. And also, give me something, and of course, because they want to build Taj Mahals are expensive. And I'm like, I understand you got a Taj Mahal, I understand what's going on. I cannot go to a prospective customer and say it costs X when it really needs to cost 10% of X. So you need to strip out a whole bunch, and maybe we sell them like the tile in the Taj Mahal, and we charge them like 10 cents for it. And I can sell Taj Mahal tiles, but I cannot sell the entire Taj Mahal. So being able to get them to and Scott and Cliff were great, where I would I'm like, look, this is not my opinion. I'm just telling you what the market is telling me. This has nothing to do with my opinion. So like we need to like respond to that. And so we were able to get to a price and a product that actually had a fit. And then you apply that to a niche, and then you bowling alley that to like other niches. And it takes time. And it took us from really until 2012. So it took us 5 years between like nothing and like the beginning of the hockey stick where we were actually generating a significant amount of income. So it's 5 years. And when we got started at Compass, I told my wife, I'm like, I'm not going to do this forever, but give me 5 years. And I just guessed as to why 5 years.
Well, I was going to say, is that a typical horizon for the startups that do succeed is 5 years?
No,
or you just picked it
startups fail. Startups fail because they run out of money. It's very simple. It's your as soon as you hit positive cash flow, your runway becomes infinite, right? So all you have to do is become cash flow positive, and your runway is gone. And that's what we did. We got our runway to cash flow positive in like year 2 or 3. Because we didn't spend any money. Yeah. So getting to, and they call it ramen profitable. You want to be so cheap that you want to get to profitability. And what happens is that when you get outside, so I actually think that the model of venture capital funding for healthcare, it can work in some situations, but in a lot of situations it doesn't work. Because when they give you a lot of money, they want you to spend the money. And they want you, the most valuable thing to them is actually time. They want you to grow fast. And to a certain extent, you have this, it's like cheese and wine. You have this, fermentation period of 3 to 5 years that you kind of have to go through in order to be able to make it stick. And so I would say that in the history of startups, that Compass might have been one of the most capital efficient startups in the history of healthcare startups. We used so little capital. We used too little capital. Arguably, we used too little capital. We could have been much bigger if we had actually used more. But the point is that it is, in my opinion, it's that sales process in the beginning that is so difficult. It's hard, which is why so many startups fail. If it was easy, then these startups wouldn't fail. Mm-hmm. But the sales process in the beginning is super hard to do. There's no easy answers for it, yada, yada, yada. But at the end of the day, if you're having trouble with it, that's totally normal because it's really hard.
Yeah, that's fair. And I'm glad that you are able to look back now and give the perspective in hindsight of a successful venture? Because I think the lessons you probably learned along the way, I'm sure there was plenty of bumps and bruises, but you also were able to learn what works in real time, which I think is fascinating. And we probably could fill a podcast of just that discussion, because I do think, just knowing what you've accomplished and what you guys were able to do and creating a category in and of itself is fascinating to me. Before I know we got to wrap here pretty soon. I wanted to ask a couple things in particular to get into, if you don't mind. I would love your perspective on content creation, because obviously you've dived in head first on this. Kind of want to hear about your motivation for it, as well as maybe some advice to some other folks out there that might watch a podcast like this or see some of your videos and think, oh, I can maybe do that, but then they get scared to take that first step. So yeah, I'd love to hear your perspective.
That's very interesting. So thank you for asking that, Spencer. So in terms of internet trends, that more and more of internet consumption is going the way of video as opposed to text or even audio, and more is going video. It is incredibly easy to generate video, and videos that are viral or have a great amount of impact do not need to have a lot of production quality. So to think that you need to have a lot of production quality to create video is wrong. The word content is actually what is the most important piece. And that content either has to be one of two things. It either has to be educational or entertaining. You can have edutainment stuff, and you can have some like ASMR meditation stuff. Those are some other categories, but really education and entertaining are the two categories. Okay, so in order for the content to be educational, it needs to be, the person who is actually delivering the information needs to have a certain degree of subject matter expertise. Mm-hmm. Okay, so perfect example is you and your self-funding with Spencer. Because you have self-funding expertise, you were able to educate incredibly well about that. Now, you didn't try to educate about things that you were not a subject matter expert on. It's like, let me tell you how it really is. And you did that with attachment points and corridors and all that awesome stuff. And everybody has an area of expertise that they have. So the point is that you pick a niche that aligns with your area of expertise, and then you just go with it with the content creation. Now, so that's the strategy in terms of the content creation. Now, there are certain content creation tactics that you can learn on YouTube, right? I mean, it's not hard to do. You just go onto YouTube and it's like, how do I make a good video? And they tell you, okay, one, you don't need, the camera is actually the least important part of content creation. The most important part of the video of the content creation is actually the lighting. Yeah. So I screwed up the lighting a ton in the beginning. And so actually like working on how to get the lighting right is a big, and there's like a zillion YouTube videos on how to do lighting. Okay, so one is pay attention to your lighting. Two, the next one is like paying attention to your audio. Okay, so like the audio is also really important. And it doesn't have to be perfect. My audio isn't perfect on mine. Okay, so that's fine. Okay, then the other tactical piece is that the content needs to be quote unquote good. Okay, it needs to actually be educational, actually needs to be entertaining. Okay, so then how do you do that? Okay, so one of my favorite quotes is from Linus Pauling, who's one of the few people who won 2 Nobel Prizes, one for peace and one for chemistry. And Linus Pauling said, in order to have a good idea, you have to have a lot of ideas. So to think that every one of your ideas is going to be good is ridiculous. You need to have a ton of ideas. And only, 80-20 rule, right? Only 20% of your ideas are going to be good. So you need to create a lot of content. And it totally stratifies. If I look at my YouTube views and watch time, 80% of my YouTube watch time comes from 20% of my videos. I wish I knew a priori which videos were actually going to be. I create these videos and I'm like, this is a horrible video. And it will be one of the most popular. And then I created one just the other day and I'm like, this one is fantastic. And nobody watched it.
Well, that's just it. Like the audience is always right. It's a funny thing that you have to learn. And to your point, the very first video I made, which was literally Stop Loss 101, had no idea about lighting and framing and all that stuff and audio or anything, and used my previous version of my iPhone to do it. is still by far the most watched video I've ever made. And I'm like, well, if I were to go back and make that video now, I would change about a dozen different things. The content would still be the same, but the way that I shot it in the production, those things. But I think the one thing that you emphasized to me on that call we had a few months back was, hey, it doesn't have to be perfect. I still use my iPhone today. I use a little lapel mic on occasion, or if I in a room that's good, I have a separate microphone, but it doesn't have to be perfect. As long as it's at a level, in my perspective, that is not disengaging, where you turn it on and go, oh, that is so bad, I don't care what they have to say. It's got to be just at that threshold. And then as long as you said, like, you deliver on the actual subject matter itself, I think that is where you will get a little bit of traction. And I do think consistency is another one of those things that's important.
The other thing, so a couple other tactical things too, is that if you're going to put things on YouTube, your thumbnail is of utmost importance. So you actually have to spend a lot of time making your and there's videos on YouTube about how to look at thumbnails.
I've watched them.
I have horrible videos that have a good thumbnail, and people watch that stuff. And I have really great videos with horrible thumbnails. People do not watch that stuff. Okay, the other thing is that when you talk, a lot of, whether it be a vlog or whatever, you want to have the shot be from about your navel, your belly button up, and you want to include your hands, and you want to speak with your hands. Because if it's just your face, a lot of times when people are educating, they just kind of zoom in on their face, and frankly, it's just kind of weird. Because when you look at somebody, and this was not intuitive to me, I watched a YouTube video about it. When you look at somebody, your view that you focus on is more than just their face.
Right.
So when I look at you, I'm basically looking from your navel up.
It's
so
the proverbial 3-button shot, right? I think is what they call it.
See, look, I didn't even know that. Yeah. It has a name, but that's because otherwise your videos are going to kind of look, it's strange. It's going to look weird, right? So you've got to do that, and you've got to. My kids always make fun of me that I speak with my hands, but that's how we've all heard this before, right? About how 90% of communication is not with the words that we say; it's with so much of it is nonverbal as well. And so people are kind of used to when they listen to somebody, they kind of want to watch what their what their hands and their facial expressions are doing as well. So you got to incorporate that. You have to lay on the enthusiasm, because the mic and the video will just suck the enthusiasm out of you. So if you act like normal, this is how I kind of normally am. Mm-hmm. And at this point in the podcast, all of your listeners are going to be like, oh, he sounds kind of down.
Well, let's bring it back up.
This is kind of boring, and it's like, and that's just how, I don't know why that is, somehow the electrons get altered, but and you have to put heat on the ball. Yeah, you gotta zing it in there. In tennis, it's called a pusher. You don't want to be a pusher. You got to put some heat on the ball when you're throwing it in there.
Well, I think that's I've noticed in this the Zoom year that we had of 2020, where everything went to virtual meetings and virtual presentations. I was resistant at first, and then I realized, well, hey, this isn't going to change anytime soon, so you better really adapt to this new model of selling and this new model of communication and meeting. And it also was at the same time that sort of precipice that led me into creating the first stop loss video. It's all right, well, let's dive in head first, because I can't change this right now, so I might as well learn to adapt. But I do think you're right, too, that there is... Being in person, I'm glad we get to host this in person, because sitting across from you, there's a level of energy that you might not perceive in over the waves, over Zoom. And I love just as a salesperson, I just love being in the same room as people. It's so much more fun. It's so much more engaging, and you feel like you have a much better read on the person you're talking to, rather than doing it over.
And this is what I found to be, because I actually still do, so I have an insurance license, and I actually sell individual Obamacare policies through Texas Family Insurance. And I'm doing it pro bono, but I'm helping a local direct primary care practice work with employers. And so I'm still involved in selling. So I've been doing selling during this virus. And I also did a ton of remote selling at Compass, because we were too cheap to afford for me to get on a plane.
That's
right.
Fair.
So I did a lot, because I'm like, well, I don't have $150 to get on a Southwest flight to go to Houston. So we're going to do this over the phone. And I'd make up some sort of excuse. And so other than we don't have money, right? My schedule's packed. So here's what's very interesting is that what do most salespeople look like? They're attractive. Okay. What are most salesmen? What do they look like? They are tall. By definition, they are using their physique and their charisma to sell. In a virtual environment, they lose that ability. So if you are a salesperson who actually is a subject matter expert and can actually adroitly walk them through the buying process, then you will be far superior to the salesperson that uses their attractiveness and their height to sell. And there are people that have sold billions of dollars worth of business that if they were not 6'4", they would have never been able to do that because they essentially intimidate their audience into buying. It's very alpha male wolf-esque, and people absolutely respond this way. And there have been entire books that have been written about this, and that has been taken away from them. And so to a certain extent, I'm saying this because I'm 5'8", and you're about my height.
I'm 5'8" too,
and
so I struggle in the height
so
department.
it was just shocking. And what does that mean about what they're selling? It means that the person who's making the buying decision, by definition, is irrational. Because if they were rational, they would not be swayed by the salesperson's appearance in their buying decision. Let me give you another example of that. Amazon Web Services has over 1 million customers. Do they have a lot of really good-looking salespeople? No, they don't. Who are they selling to? The IT department. What is the most rational part of a business? It is the IT department. Okay, so what does that mean? That means that if you're a salesperson who's selling something new, especially in the place of self-funding or employee benefits or what have you, that if you want to, you actually want the rational sale. You don't want the emotional, I'm attractive sale. You don't want that sale. You want the rational sale with the benefits nerds. And the benefits nerds, they don't want to talk to you in person. And I sold 3,000 life groups. I sold a 5,000 life group completely over the phone. It wasn't even a video chat. It was just the phone, okay? Because they were nerds and I was a nerd, and we were able to have a rational nerd conversation together. And so really, and I'll stop with this. So really the success for selling in the employee benefit space is in the finding. It's really in the prospecting. The key to sales in the employee benefit space is the prospecting. And if you can prospect well and your sales skills actually kind of stink, you will succeed. And so the best thing you can do is stop listening to this podcast right now and call 10 people.
Yes.
Just call them. I don't care who you call. Call your mom, okay? Yeah. You have to talk to people and you have to constantly prospect.
Yes. And after you make those 10 calls, jump back on, and we got a couple minutes left.
Of course, listen to Spencer
Don't
more.
listen to Dr. Berger. Please stay tuned. Last thing I want to do, and I would love to hear your perspective on this, especially because I think you do have a finger on the pulse of our industry. So, crystal ball, where are we going? What is the future of solving the crisis, if you will, look like from your perspective?
I just made an AHealthcareZ video about this. So no one can predict the future, right? That's one of the classic things. Anybody who says that they can predict the future is totally full of it,
sure.
Right? Warren Buffett's like, I can't predict the future. Nobody can predict the future. But what you can do is you can look at the past and know that that history repeats itself, not exactly, but it rhymes, right? That's a famous Mark Twain quote that, history doesn't repeat itself, but it rhymes. And so it's very important. Like a good good salespeople are so smart. It is like, I've talked to good salespeople, and good salespeople love history, and they read history books. And they do that because they're trying to predict the future by reading all this history. And it totally works. And so the video that I made specifically said that, look, the march towards greater federal funding of healthcare in America has been going on for almost 100 years since FDR. It is not since LBJ and Medicare. It is not since Obamacare. It is not since the attempt with Bill and Hillary Clinton and Hillary Care. It has been on the Democratic Party agenda for almost 100 years. And this is not a partisan statement. But what this says is that if you have roughly, let's just call it half of America that is pushing for something to happen, then chances are eventually it's going to happen. And we've already seen it happen from the very beginning to and then we even had, it's become bipartisan, right? Because George W. Bush even passed the Medicare Modernization Act, where they added Medicare Part D to actually have Medicare cost to cover prescription drugs. So you have expansion of federal funding for healthcare. So that will happen. Will that happen over 10 years, 15 years, 50 years? I don't know. But the question so what that means is that the healthcare industry, health insurance, self-funding, the whole financial side of healthcare is going to look like the defense industry, because defense contractors can only sell to one group, and that's the federal government. Sure. If you're going to sell a fighter plane, who else are you going to sell it to? You're going to sell it to one place, the federal government, and the federal government has to give you permission to sell it to another country. So you need to think about, okay, well, what what aspects of the defense industry, and there's very large defense contractors and there's small defense contractors. There's defense contractors that just do software. There's defense contractors that just do hardware. So what about the defense industry can you learn so that you can prepare yourself for when the health insurance industry looks like that? Let me give you one example. Where are all the defense companies located? Their headquarters are in the suburbs of Washington, D.C. That is where Lockheed Martin's headquarters is, right? Amazon is not stupid. Where is Amazon building their next headquarters? In Washington, D.C., right? Because they know they want to get into healthcare. And if you want to get into healthcare, you got to cozy up with Washington, D.C. So this is a general direction. It is not something that's going to happen immediately.
It's not linear always as well. Yeah.
It's not. But I can tell you that in 15, 20 years, we're going to be looking at more federal funding of healthcare. And you're going to be looking at an industry that looks more like the defense industry than it does right now.
Awesome. Well, fascinating, and I appreciate the answer. Last but not least, if folks want to engage with your content, where should they go?
Just go to YouTube and look at AHealthcareZ. You can also connect with me on LinkedIn, so just Eric Bricker, MD on LinkedIn. And once again, Spencer, your stuff is so good.
Thank you, sir.
And your listeners are really benefiting from the intelligence that you are bringing to them, that frankly, you are a role model to me as well. And so I just want to thank you for that too.
Well, I very much appreciate that. Thank you for that as well. And thank you for coming on. I would certainly welcome you back here sometime soon, because I believe we could have hours of conversation together. So again, thanks to Dr. Bricker for joining me. Thank you to VentureX for the space. And thank you to PlanSight, as always, for the sponsorship of the podcast. I'll see you guys soon.